Brilliant. So welcome everyone to our latest conversation that challenges, or conversations latest of our conversations that challenge. That's a better way of saying it. Um, my name's Oliver Townsend, and I work for Platform, which is one of the partners involved in the New System Alliance, along with Homeless Network Scotland and Mayday Trust. And we're really delighted to have so many people online today to hear from Ginny Cooper, who is from the Homeless Network Scotland, and she is the improvement advisor there. And she's here to talk about the work that they've been doing around No Wrong Door, which is always really exciting. And I'm going to be really biased towards the Celtic nations at the moment. So if you excuse my little indulgence, it's been really interesting seeing the journeys that Scotland and Wales have undergone around homelessness and system improvement over the last sort of 5-10 years. So my background is I've worked for Commonwealth Cymru before Platform, which is a homelessness representative body similar to Homeless Network Scotland. And you can really see in the movements around homelessness in Wales, for example, we led with the Housing Wales Act, which locked in a preventative approach into housing legislation. And that influenced the questionable but still helpful and progress of the Homelessness Reduction Act in England. And Scotland in particular has also taken forward a preventative kind of agenda, but particularly has really led around kind of the no wrong door approach and other approaches towards homelessness. So what we're seeing is certainly in terms of housing, the Celtic nations and devolution really being used to test new ways of working in a really innovative and interesting way. So we're hoping today will be really helpful for people. But also I'm really interested in how listening to the Homeless Link's approach to learning from No Wrong Door implementation can also be used across the New System Alliance to think about how we can learn in other areas. So even though this does talk a lot about housing and homelessness, the learning and the approaches we take from it could be really helpful to all of us in our different systems that we work in. So you don't need to be a housing expert, don't worry. And Ginny is very, very good at taking us through that in a very accessible way. So that's enough for me. I'm really excited about this session today. So I will hand over to Ginny. Thank you, Ginny.
Thanks very much, Ollie. And Ollie always talks about the work that we do at Homeless Network and in Scotland probably better than it actually is in reality, but we're trying our best. So I'm Ginny. I work for an organisation called Homeless Network Scotland. That, as again Ollie kind of mentioned, it's a membership organisation. We don't deliver any frontline services, so that can sometimes be a bad thing because we're obviously not connected to the ground, but it can be a great thing because it gives us the opportunities to really kind of push the boundaries and try and influence and influence that change that we need to see within the homelessness and housing sector. All the work that we do is in partnership with delivery organisations because we need that information from the ground to be able to kind of make the changes and have the influence that we want to have. So that's a really, really important aspect of the work that we do. The other side of what we do is we work really closely with the people with lived experience. We have an associates program inviting people in to be spokespeople around the change that needs to happen from the perspective of people that have those real life first-hand experiences. So I'm going to share my screen. And as I said, I haven't used Zoom in a while, so hopefully all of the things I'm doing, everyone can see that. So one of the projects, and I hope the reason that you guys hear that we've been developing recently is the one that we're calling No Wrong Door. I'd really like to spend this opportunity kind of introducing our thinking behind No Wrong Door, and then kind of have a session where we kind of open it up to you guys, so we can kind of have a bit of reflection around it, an honest conversation about what this kind of idea might look like in your areas. I'd love feedback, but also I'm really happy to answer any questions that you might have about where we're going with this project. It's We've probably been working on it for a couple of years now, but we're only just at the point where we're kind of working with those delivery partners to make it actually kind of translate from this kind of big idea to something that's actually going to translate into practice. So, yeah, we definitely don't have the solutions. Let's just say so. It's a learning experience. So we come from the starting point that we know that although most of us interact with services to help build the lives we want to live, some people need to interact with more than one type of support. And these people are usually ones that have lives that are shaped by poverty, by trauma, by violence and abuse. I'm sure this room doesn't need to be told that. People who face this kind of disadvantage have the most need for those services to be joined up. But they also have are least likely to get that joined up support and have that choice and control over it. So services are set up to respond to single issues as part of different sectors, each with kind of different systems that they're working around and ways of doing things. Nothing matches up. But we know that people are complex with their own unique range of experiences, relationships, and factors that make up their lives. So by having services set up like this in these silos, what it's doing is it's causing us to shut people out of services with long waiting lists, out of the area referrals, and it's also making us trap people into services. Two things that we don't want to be doing. So we kind of came to the conclusion that what people need is to find no wrong door, is to find one route in where they're not either shut out or trapped into the services that they require. So we believe that by taking a place-based approach, we can learn why people are being let down by the system and how to prevent it from happening. So we can share our learning more widely and improve real life outcomes. We don't believe that there's a large scale problem. We don't believe that large scale problems require kind of large scale solutions. We believe that you need to kind of really home in on place-based approaches to understand what is needed, cross-reference, and then scale up to create a framework that others can use and hopefully apply into their situation. So we know in Scotland, we're lucky that Scottish Government policymakers recognise the problem with a growing range of social policy and strategy committed to this joined up, no wrong door service approach. However, there's no shared definition or an actual national framework to inspire and connect local action. So we realised that, especially during lockdown, no wrong door was kind of being mentioned here, there, and everywhere as a solution to the issues we have about kind of siloed service provision, but no one was really being clear on what no wrong door looked like. So what we want to do is create that framework to help define exactly what no wrong door means, not just in the housing and homelessness sector, but for all the sectors, so that everybody is starting from the same baseline. We want a framework that identifies the principles from the place-based learning that we're going to do, which underpin that no wrong door, so that the model can be repeated and modified to different places. And we want to encourage that continuous learning model and give people the tools to be able to implement that into their kind of day-to-day working. So we had identified our large scale problem, that people with severe and multiple disadvantage are more likely to get siloed and uncoordinated service response. But to translate that to practice, we needed to come up with a way to tap into the people and the communities that were experiencing these services to learn from them in a way that we could then think about different ways of doing things. So we wanted to work in a range of locations because we knew that we couldn't just learn from one area, because in different areas the problems are going to be different, the people are going to be different, and therefore the tweaks to the system would need to be different. So a range of locations so that we can make comparisons and learn how different contexts affect service delivery. We knew we needed to find people that were already doing great work. So we didn't want to come into, because we're not service delivery organization, we never like to go into a space and say, this is what we're doing, this is how you need to change, and all of that. We knew we wanted to find people that were already doing great work that married along with our thinking, and so that they could kind of champion what they were doing and us support them to champion that work. We wanted to make sure we were always going back to asking the question, how is this improving people's lives? I think often kind of these big ideas can lose sight of what the actual kind of purpose of doing this work is. So it's about kind of homing in and really focusing on the real outcomes for people. And then finally, we wanted to put big emphasis on learning. And that's what I'm going to speak to you a bit about today. So that things don't just change overnight, that the idea of kind of implementing this continuous learning loop, so that people are able to check in, reflect, and make any tweaks to the changes they want to see as they're going along, so they don't get to the point where they've kind of put lots of energy into making the changes and then realize that it's not actually creating those better outcomes from people in the long run. So to make our kind of ideas a reality, we created an action learning partnership with 4 third sector organizations. So these organizations are leading the tests of change on the ground. So they're the eyes and the ears, finding out kind of what we need to put into this framework to allow other people to be able to change their services towards no wrong door. And they have a centre point in a local area. So Aberdeen Foyer, a charity who are working in Aberdeen, funnily enough. Cyrenians, they kind of work a bit all over, but their particular focus for this project is in Edinburgh. Turning Point, again, national charity, but they're going to focus this project in Fife. Penumbra, again, national charity, but they're going to focus in Dundee. So these are kind of services and organizations that we know, they're members of our organization, and we do exciting work with them already. So we've already built up that kind of trust, but they were able to prove to us, well, it wasn't about proving, that they were able to present some work that they were doing that we thought really married with the thinking that we had around no wrong door. And they were also up for adopting this kind of learning cycle, which I guess is an important aspect of it. So the first step, when we got together, we started kind of discussing what's kind of the overarching learning question that each of these places want to ask in their communities. And this was really important because it was totally dependent on what was happening in that community. None of us from Homeless Network could have gone in and given them a learning question, because they were the ones that knew the thing that they wanted to explore through this test of change. So they're really different, and what we hope from these learning questions is that they're going to take each of the different organizations on slightly different paths. That they're going to grow in different ways, they're going to bring in different people, and that means that we can really learn about how this looks in different contexts and and in different places. So Abby and Foyer are asking the question, how do we improve outcomes for young people in the Northfield community? So Northfield community is a community that they work with quite often, and they're really interested in kind of the preventative approaches to try and catch young people earlier to improve their outcomes and prevent them from experiencing homelessness. Edinburgh Cyrenians, their question is, how can health services protect homes? So they're doing work within hospitals to try and make sure that people don't leave hospital and end up homeless. Something that's currently not very connected, that definitely needs to be connected to make sure that people aren't put in bad situations after they've been in hospital. Turning Point, focusing in Fife. Turning Point are doing some great systems work anyway. So their questions are quite broad around how can we deliver a whole systems response through a single point of access. So Turning Point traditionally do quite a lot of homelessness work, but they want to kind of broaden their work quite a lot. So they want to look at that, what they can do as an organization to deliver that whole systems response. So that's a slightly different angle, which we're really interested in. And then Penumbra, they're a mental health charity, and they're talking about how can a community hub ask and act about housing, health, relationships, and money. So they're wanting to set up a community hub in Dundee, and they want to make sure that that community hub is really focusing on all the aspects that people might need support for, and not just making it just a mental health service. So these organizations, they will coordinate local activity and invite broader partnerships to get alongside. So they'll be using their contacts, connecting with the local councils, and starting to connect and share and champion and getting people to start championing for change. So the reason that these 4 sector leaders are great for this work is that they're already recognised as innovators in service design and delivery. They are specialists in enabling people facing severe and multiple disadvantage. And they already think systems and are committing to finding solutions at that local level. So they're a good kind of segue between kind of the high-end thinking and what's happening on the ground. And they've got great connections with all the other services that are provided in their area. Homeless Network Scotland, my organisation, are predominantly the learning partner in this. So we're capturing all this learning, or will be, because we're not quite at that stage yet, and using it to create this framework. We're bringing people together to try and capture that learning. So in its most simple form, we are adopting, or the organizations, place-based organizations are adopting a place-based learning cycle. So this is all about stopping, reflecting, making the tweaks, and making sure that everything is reviewed before embedding any permanent changes. And we see this as a constant learning cycle. So you do it as many times as you need so that you can be confident that the changes and tweaks that you're making are the right ones. So we see this learning kind of happening in different layers of the system. So the first layer, which is what we're calling our center point, this is where the impact is felt directly on the people who are navigating different services and systems, and also on those organizations that are getting alongside them. So through our center points, we're able to learn what's working, what's not working, and importantly, we're able to learn through different lenses and different contexts within the different areas that we're working. So it's these center points that can tell us when a service is joined up, aligned, and equal, and how that's working, and we want to learn as much as possible from when things are working. But they can also tell us of when it's not working, because then we can start questioning why. At that person level, we've got 4 asks, and the one that we talk about quite a lot, obviously in Homeless Network Scotland, is asking about housing, and we have been saying that for a while now, but also specifically with this work, we want people to be able to ask about housing, about health and well-being, about relationships, and about money. We think that if people who are supporting people are asking these questions all the time, we'll get much quicker to the crux of the matter, and to a point where we're able to support them. These for us are the kind of the essential things that we need to be having conversations about. So yeah. Sorry, and then that was the only reason that slide was there, was so I can I can show you it growing. So the next level is place. So the centre points will host local learning cycles within a place-based context. So this is for 2 reasons. This is to compare the experiences with other organisations. So they've done their learning within their own organisations around what's working and what's not. And this is a chance for them to come together and to compare those locally, to challenge each other about what's happening, sharing learning, and bring together those shared experiences and themes. It's also to have influence on the local decision makers, who will hopefully be committed to this process. So they're currently in conversations with bringing in local authorities and having these conversations about how commissioning might need to change to support these things, and how the support of the local authorities can change to support programs like this. So that's the place-based learning. And that's that cycle again that they will be using to make sure that they're stopping, reflecting, and tweaking things. One thing we think that's important at the place-based level is that local partnerships all adopt these 6 ways of working. So this is all based on evidence for tackling disadvantage. And we believe that we can only really create no wrong door framework if our partner organizations are adopting these principles. These are kind of the bare bones of what we want these services to be. We want them to be preventative. We want them to be coordinated. So that touches on that kind of not working in silos, person-led, of course, place-based. So we're naturally doing that by having those 4 tests of change in different areas, trauma-informed, and equality competent. So the final layer of our learning cycles is at national level, and this is something that Homeless Network are facilitating. So we've invited policymakers, commissioners, system change advocates, local people from the areas that we're working, as well as the lead organisations that are pushing this work in the local areas, to join a learning group. And the idea is that we'll get together on a regular basis and share that learning towards creating this national framework. So much like in the place-based context, organisations bringing their learning, cross-referencing, sharing experiences, we're just going to do that at a slightly bigger scale and start really kind of understanding the patterns that are coming out of each of these different tests of change. But we found it, as well as kind of getting the policymakers and commissioners into that room, we wanted to make sure that the local people were also in that room so they can be part of that conversation, because otherwise there's going to be a disconnect. There's going to be something that goes wrong along that translation. So that was really important to us. So our first event where we get all those people in a room will be in September. This is just a table kind of thinking, explaining the learning that we want to be doing. So down the left-hand side there, you've got those 3 layers. the kind of organizational layer, the place-based layer, and the national layer. And in that orange, that's the focus that we're having. It's about capturing those patterns that we're seeing in each of the 4 areas so that we can really highlight what's working, what's not working, and if something's not working, what needs to happen to change it. And hopefully those 4 tests of change will be able to make those tweaks and learn from those tweaks so that we can then say, this is what's happening in this area. It's likely that it's going to happen in other areas that are working in similar contexts, or it's happening in this area and it seems really unique to this area that that's happening. So that's the kind of information that we're looking to get out of them. And then we're going to have observations on policy. So what policies need to change to enable change for people. Having that kind of national learning group will allow us to have that conversation with the people that are experiencing the things that need to change and the people that are making the policies. And we can have that really honest conversation saying, with the people on the ground saying, this is the barrier, and the people that are making decisions telling us how we're going to try and break down that barrier and make things easier for people. Resources. So at the different levels, resources are a little bit different. So at the organization level, we ask what resources are needed, very simply, to make those changes happen. At the place-based level, we say, how do we fund organizations to learn together and to solve problems together? So how do we give them the money, the space to be able to do this work? And then at the national level, how do we enable this with funding learning workforce? So we're being honest about the fact that we can't just come along and say, you need to have these learning experiences, and that's extra work within your day-to-day working. We're saying, if this needs to happen, and if this is the way we want to work within this kind of learning environment, what resources do we need, and how are we going to fund them and make sure that people can work in this way? The third point is mindsets. So what mindsets and behaviors are there, and what do we need to shift? So this one, I find this one really interesting. Obviously, change isn't going to happen if the people on the ground don't have the capabilities or aren't in positions where that they can make that change and don't have the mindsets to do that. And it's a really complicated thing to try and shift, and we really need to understand what those mindsets are and what is needed to help people make that shift. Then at that place-based level, how do we enable learning between organizations? Again, you know, this requires a bit of time, it requires a bit of resources, what's needed to help people actually do this work, and what staff capabilities do we need, and what do we have? So I think I've kind of spoken to that already. I'm going to stop there because I'm sure you've had enough of listening to me. That's our thinking so far. It's at the point where we've been thinking about it for a very long time, and recently it suddenly kind of shifted into, we need to translate this onto kind of into these 4 areas, tests of change. We're currently in the process of creating a toolkit to help each of our tests of change ask the questions and do the learning and find the right spaces and invite the right people in. We're also providing support, so we're going to go into each of the places and facilitate some conversations. We completely trust that the lead organizations that we're working with can have those conversations and can do the work, but we also are really kind of mindful that they don't have the time, they're doing other work. So we're kind of allowing for those to kind of open up those spaces and to kind of take that pressure off them to have those initial conversations. So yeah, so I'd be happy to answer any questions about what I've presented today. I thought then in the rest of the time, we could maybe break out into some breakout groups, and then after the breakout groups, come back and have a bit of reflection. But the things I'd be really interested to hear your points of view of is bearing in mind that we're trying to create this toolkit to help these organizations capture the learning and perform these learning cycles in a way that doesn't feel like more work. What I'd like to know from you guys is, in your opinion, how can we ensure people buy into this learning and see the benefits of it and don't see it as additional work? I'm very happy to take any criticism and talk that through. I'd also love to know what you think a test change might look like in your area, if you're kind of listening to this and thinking what that might look like. We could kind of have a bit of a conversation about that. I can put those two questions in the chat. I'm not sure, Ollie, whether you can
We've
see
had
the chat from the breakout rooms.
we've had a couple of questions already, and
Oh,
I'm just wondering based on sorry, my throat is quite sore. I'm just wondering, based on numbers of people, whether people are comfortable just chatting here,
yeah.
because then it's in one recorded place, and we could just kind of see where the energy goes. So yeah, so the first question was whether no national level mindset aims. I don't know, Jane, if you want to expand on that, or if Ginny, you want to go straight into an answer. I'll see if Jane wants to come in first.
Yeah.
Yeah, I'm happy to come in on that. Absolutely delighted with that presentation, Ginny. And also to see your four partners are organisations, very, very well established organisations. They've been around a long, long time. And I certainly worked with all of them when I worked in the third sector in Scotland. And that's why I asked about the national mindset. Sometimes when you've got, and I understand that you're looking at the organizational mindsets, but they're quite often squashed, perhaps is not quite the right word, imposed on by the national mindsets. Changing in governments can do it, things like that. And I just wondered whether there was anything you could do to support how those organizations can withstand the external pressures from the national level.
Yeah, absolutely. I mean, we're lucky in the sense that we hosted an initial kind of information session with some people within Scottish government, not ministers, but kind of people that were quite high up in each of the sectors that we thought were kind of important to get involved in this. And we got great buy-in from them around No Wrong Door. But we know that there are challenges, and kind of at that national level, people can kind of be very they can say that all the work sounds great, and yes, they definitely sign up to it and all of that, but in practice, are they actually supporting it? And I think that's why we thought creating that kind of learning group where we've got both people from kind of decision-making roles and commissioners and things in the same room as the people that we're wanting to change the mindsets on the ground. We can have those honest conversations because without that, I think you're right that it will feel challenging for the people at the organizational and place level to feel like they can change the mindsets. So we're really hoping that creating those spaces for that conversation, we will be able to kind of create, understand that. Why it's not in the table is a really, really great question, and I think we could probably add it as a space where we do want to change the mindsets at a national level as well. I think what again, and maybe we fall back on this too much and maybe it's wrong, is in Scotland we have such good policy around these things, and everybody is saying the right things, that we sometimes think, oh yeah, we don't need to change the mindset at that level. But I guess the important thing is to remember that if it's written in a document, it doesn't mean that it's necessarily being thought by everyone, and it doesn't necessarily mean that it's happening. So, so yeah, a brilliant point, and I will definitely take it into.
Perhaps use the word influence rather than change in that particular block.
Yeah, absolutely.
Brilliant.
Thank you, Jane.
Thank you, Jane. Thank you, Julie. So we've got two questions from Sharon, and only jokingly, just in case people thought I had blocked Sharon. Obviously, I haven't blocked her. But the first one, and you'll see why I was tempted to, Ginny, in a second,
Oh God.
is great insight, Ginny. How are you tracking the findings from your housing, health, relationship, and money conversations? And then this is the bit: do you have common KPIs across all four areas? And obviously, just for full disclaimer, we are joking. KPIs can be really important. So, but yeah, just wondering about that. And then there's a second question.
Oh
Actually,
wait,
no,
Ollie, I'm not going to retain all this information.
let's do the one first. That's fine.
So tracking, I've already lost it. Findings, I can see it though. Findings from your housing, health, relationships, and money conversations. Good question, and that's where we are at the moment. So we are, as I said, we're currently creating this toolkit, and we're very aware that the questions that we need to be asking are focused around those four asks. That's kind of our starting point with the toolkit and with the questions that we're asking at all the levels, really, because we kind of see that as the baseline of what we need to understand. So I guess I can't give you a proper answer because we're not quite there yet. I'd love if anybody had any ideas, share them. But I think it's about kind of asking the questions around kind of what's working and what's not working. And I guess understanding how people can be in the positions where they can ask and what we often say, and then act on housing, health, relationships, and money. There's currently a new housing bill going through Scottish Government at the moment, and we're really excited because it was based on lots of work that we did. That one thing that's going through is a new duty to ask and act about homelessness, and that basically puts a duty on other public bodies out with housing and homelessness to ask and act about homelessness. So it means that if you go into your GP's practice and you're complaining about stress and anxiety, that GP has a duty to ask you whether your housing situation is safe. And we kind of believe that we kind of need that policy around health, relationships, and money as well. It should be everybody's responsibility to be asking about those things and then acting on them. So whether that's doing something themselves or calling someone who can give that support if that person is saying that they're struggling in that way. I don't feel like I've properly answered your question, but I hope that's helpful.
Thank you. And then Sharon's second question was, how have you shifted the competence and confidence of system leaders and I couldn't quite understand the conclusion to the question, Sharon. I don't know if you want to expand on that.
Yeah, hi. Thank you ever so much. And my confession around KPIs, I'll give myself a talking to over lunchtime, but it's just really important, isn't it, to try and understand the impact and how you talk about the impact of the work you do. So sorry, yeah. So my competence and confidence question is that this is potentially a big step change in the way that we work and support people who are often most underserved. And that takes some bold leadership to then put money into commissioned services that support people differently. And so I'm just thinking about how what your narrative around the No Wrong Door project is with system leaders around how are you changing their confidence and courage to work differently, if that makes sense.
I think we always go back to the evidence. We've got a great report in Scotland called Hard Edges Scotland, which talks about those people who are being really let down by the system, and those people having to tap into multiple services, and those people who No Wrong Door is really designed for. So we always kind of go back to that to kind of refocus into kind of why we're doing it and the types of outcomes we need to achieve, and then also we've adopted, so we've actually joined forces in Scotland with a few different people who are kind of committed to the human learning system, which is another theory around kind of place-based learning cycles, and we've actually taken quite a lot of kind of our learning techniques from that. And what we're trying to do by being part of this kind of group that are learning themselves about this human learning system is make sure that, yeah, we're not losing sight and going down a way, like one track that might not work. Basically, we are practicing what we preach, and we are being connected to them. And there's a guy that we connect with quite regularly from Health Improvement Scotland, who's doing loads of work around learning cycles and introducing it into the NHS and things. We're tapping into making sure that everything that we're doing is robust and is being practiced and is being shifted and changed through the learning. So yeah, I hope that will give people confidence that we're very aware that this is massive, and that we can't just come along and say this is how we're going to do it, and it needs to be a learning process as we're doing it. And I think we're very open to making changes as we go along, as well as learning from other people.
Thank you, Ginny. And Tom from the Woolwich has said this sounds like the new duties in the Welsh Government's homelessness white paper, which includes duties to identify, refer and cooperate with other services. And obviously, Tom, feel free to come in after this as well. But it also, in terms of the draft Welsh Government mental health strategy, which Platform have recently responded to, they do use the term no wrong door in that context as well. So I'm just wondering, Ginny, I'm just going to use the chair's privilege to ask a quick question as well, which is one of the challenges that I think we have structurally within systems around things like no wrong door, or housing first, where you kind of front load need rather than kind of wait for people to kind of demonstrate that they've proved tenancy readiness, or whatever it is that we're trying to do around the system to kind of shift resources to where we can take action really quickly and really meaningfully. My experience has been that the system resists that a little bit because, or a lot, that was me being diplomatic. The system resists it a lot because we are in a system of scarcity. And I think there's a nervousness from my experience of being the one left, and I'm going to use the phrase like left carrying the baby or left holding the hot potato. And I'm aware that seems really blasé and kind of lighthearted, given that we're talking about people's lives, but it's just the phrase to use at the moment. I'm just wondering, I think Scotland are a bit further ahead around no wrong door, and I'm wondering how you've had those conversations, or how the Scottish Government and in other bodies are having those conversations, and whether they're thinking about funding models so that we are actively funding preventative work or really early intervention, but also seeing prevention. Sorry, this is a really long question,
Yeah,
but I'm
going to lose you, Ollie.
It's fine.
Yeah, no, say what you need to say, and then we'll summarize.
But seeing, I suppose prevention sometimes being seen as more the action we take, as well as just preventing it really early on. So yeah, it feels like for me, our whole funding model is set up to prioritize organizations that pass the problem on, rather than actually help people where they are. That's a much simpler way of asking the question. Have the Scottish Government done anything around addressing that fundamental funding issue?
Good question. I think at Scottish Government level, there is a commitment towards prevention, and again, particularly in the new housing bill, prevention is massive. Is a massive part of it. Whether that translates to the commissioning, who knows? But I think there's a desire definitely there, and I guess it's organisations like ours, and by doing projects like this, which will really show the benefits of funding in different ways and allowing for that. And I think that's what No Wrong Door is also trying. The project No Wrong Door is trying to do, is to make sure that those commissioners are in the room so that they can hear, this is really working for people. But make it sustainable, we need to change the commissioning. And we are having conversations kind of behind the scenes with commissioners and introducing them to the concepts, and we're getting very good feedback from it. So I think, yes, there are people out there willing to make the changes. I think we just need to provide the evidence that it's worth doing it, and everybody in this room knows that it's worth doing it even without the evidence. But obviously the commissioners need a bit of something on a piece of paper. Yeah, I think it's that juggling that sensitivity around that, and as well as really understanding how this is going to work in practice. This project is all about chipping away at the commissioners and chipping away at Scottish Government as well, and we intend for them to be in the room listening to what people are feeding back from the ground to try and influence that change. And going back to Jane's comment about mindset, you know, that is going to be the success of this project, is making sure that those mindsets shift as much as the ones on the ground.
Brilliant. Thank you. That's really helpful. And I think it kind of leans into something Platform's been saying for a while. I know Ginny will have heard this probably till she's bored of it, but that system change is fundamentally about relationships, that it's about being relational and understanding that it's about people. So I really love this project being place-based and actually working directly with commissioners and helping and letting commissioners actually see the difference that it makes. So yeah, I love that. Thank you, Ginny. There's a question from Karen then. So how do we equip people with lived experience to have these challenging conversations? Normally when I think that's knock on the doors of policymakers, we're seen as a difficult parent. I don't know, Karen, if you want to expand on that before Ginny answers, if you've got anything you want to share.
Yeah, chap on the door's a wee Scottish phrase, same thing as knocking on the door. Yeah, no, I'm a parent carer. I work for a charity that we actively recruit parent carers and self-advocates to work to improve social care in Scotland. So we run a number of leadership programmes. But I'm just interested to kind of hear, you know, obviously being that person who has all this stuff in life happening to them, and then to be that person that then speaks to the policymakers is a really big jump. And you know, we need to look after these people. I appreciate you said about being trauma informed, and I'm really passionate about that. We can't keep wheeling out people with lived and loved experience without looking after them. So my question is, how do you equip these people to have these difficult, challenging conversations?
Yeah, it's a really good conversation, and luckily I hope I'll have a good enough answer for you. But so we as an organisation, I think, well, long before I started, made the decision that we couldn't be having these conversations or making these changes without the people that had the real life experiences. Homeless Network Scotland has always had some kind of volunteer program, which recently has turned into an associates program, and the reason for that is to make sure that we can pay the people without it affecting any benefits or anything. So we've gone through a long process to make sure that people are paid for the work that they do with us. So therefore we've got policies, we've got training programs for people with lived experience, and any work that we do out with the associates. So we will include our associates in this work to influence us and to kind of keep us on track, because they're a great group of people that have already been trained and are already really supported to kind of give us that insight. But we're also aware, obviously, that their knowledge is not kind of based in these 4 tests of change areas, and also there's only 20 of them. You know, we will probably want more insight for people with lived experience. But we will produce a program when it gets to the point of including people with lived experience to support them through this. We've got things already set up. We can link them up with our associates. We can link them up with ourselves. We can make sure that they are properly briefed. We can make sure they're properly debriefed. We're doing lots of work at the moment around environments that we put people in. So it's all well and good, as you said, saying, "Oh, come along to this meeting with a whole bunch of Scottish Government officials, so that you can give us your views. But if we're not setting up the right environments for these people to feel comfortable, then there's no point in doing it in the first place. So we're really, really kind of aware of bringing in the voice of lived experience, and we wouldn't do it if we knew that we were kind of putting people in danger and that sort of thing. So and I honestly believe that the 4 organisations we're working with are also kind of very in mind about those things, but we will support them in any way they need to be able to do it in the best way as well. So yes, it's a constant challenge, and I definitely not saying that we'd get it right every time, because depending on the environment, things can change. But we really try to provide that kind of briefing and debriefing to make sure that people are all right after experiences. And yeah, I hope that answers your question.
Brilliant. Thank you, Ginny. And Ollie has just shared that he might have some insights to share as well. So yeah, feel free to come in now if you like, Ollie. And then I'll bring Mia in.
Sure, thanks, Oliver, and thanks, Karen, to your question. Yeah, I was also a little bit late joining, so apologies for that. I work with a group called POTS Group, and for the last 7 years, we've been working with people with lived experience of homelessness to sort of, encourage them to surface their insights from their experience and amplify them in the spaces that matter. And we're sort of in the process of redesigning our organization, but one of the core methods we work with is by recognizing the role of creativity and sort of, I think the word empower is hopelessly overused, but empower people with lived experience to find the words sometimes, and find the confidence, and then find the channels.
Yeah.
Because it's, you can have the words, but not the confidence on the channels. You can have the channel, but not the confidence on the words. Like needn't complete that thing. But we work a lot with photography. So we'll often have a group of, say, 15 people with lived experience. We specialize, especially in the last few years, with housing first programs and trying to surface insights around how they work and how they can be redesigned or made higher fidelity or to the housing first principles or what have you. But commissioning, working together to sort of in a participatory way to find a brief. Okay, it's a lot. It takes some work. We did in Manchester 2022. It was the role of support, the role of recovery, and the meaning of home were 3 themes that kind of were really that the group really wanted to sort of work on. And so on that basis, we commissioned all of them to take 30 photos that help them tell a story that makes sense to them, that's rooted in their experience, that then we can co-curate with them, do interviews on the basis of, use the photos as a way to elicit insights that might not come through if you just do a regular survey or regular conversation.
Yeah, brilliant.
And those insights are co-curated, and we do a sort of quite in a disruptive public way. We do an exhibition of those photos, coupling them with interviews, coupling them with written work. So it's often about, we found that role of creativity in supporting people with lived experience to bring their insights has had dramatic changes to when we would just say, could you tell us what you think, please?
Yeah.
So that the creativity thing, and that's what, multimodal, right? So it's not just filling in a form or having a conversation, but think about different kind of ways that can suit different kinds of styles of expression or readiness to express.
Yeah.
Something that's been really, really important for us. Brilliant.
That sounds really exciting, Ollie. Especially in a place-based context, allowing people to go and capture what place means to them and that sort of thing. We've also done in the past kind of walking interviews, so allowing people to kind of walk around their spaces whilst having a conversation. So instead of kind of sitting them down in a stark room and then asking them about all their experiences, trying to get them to kind of tell us about their lives through actually walking through the places that they interact with and things. So yes, there are so many good methods to adopt, and it's great to be reminded of that, because often you kind of lose sight of it a little bit. So thank you.
Thank you. And then is it Milia?
Yes. Hi, this is Milia. Ginny, amazing work, and the questions also super helpful, each of them. So the way you create that environment in the room with the policymakers interests me, because I work as a convener of a working group that is trying to do that in the context of business. So people with no voice, people whose livelihood is uncertain and dependent, how to have them in the room with managers and executives and enable their voices to be heard. We will collect their input up front and include it in the fact base that is a shared starting point for everyone, and try to point everyone at the problem, not at each other. But whatever you could share about the work, since you mentioned you are working on how to create that environment, would be super helpful.
Yeah, absolutely. Again, it's all a learning experience. I think working with people with lived experience, it allows you to appreciate the fact that everybody has different styles, so that there's not going to be a solution that fits everyone. One thing that we did when we recruited, if that's the right word, the guys who are part of our associates team, is instead of a job description as such, we wrote kind of roles that they might fit into. So one person is kind of like confident in public speaking, likes sharing their knowledge to big groups of people and things like that. Other people maybe doesn't like public speaking but likes to write about their experiences, and another role maybe likes to discuss their experiences in small groups or something like that. So we kind of got an idea of where our associates feel comfortable in and what spaces. So therefore we know that when an opportunity arises for someone with lived experience to share we've got people that are comfortable writing blogs, and of course we'll support them to do that. And if they want it to be an interview style blog where we just ask them questions and they give us information, that's great. If they want to just go and write that blog but maybe have a bit of support in that, that's great too. There are people that hate writing but much prefer. We had a guy yesterday for another project who stood up in a room full of around 60 people, public and third sector organization kind of leaders and things, and just gave the most amazing speech that didn't touch at all on, you know, his story, but really kind of homed in on we were talking about the importance of people supporting people and those kind of support roles and the relationships built. And he was just kind of giving us a really honest reflection. And, you know, he needed no support. He was briefed, obviously, and he was told about what it was going to be like. And he ran through his ideas with a colleague of mine, but he was very confident in doing it. So I think definitely working to people's strengths and what they're comfortable doing. In terms of kind of designing those spaces, again, having conversations with those people. The thing that we struggle the hardest with is kind of decision makers adapting to fit people. So whenever it's events that we're organizing, we can be very adaptable and appreciative of those things. If it's a meeting happening between a whole load of ministers and they want someone to come and sit in it, if we say, actually, people aren't going to feel comfortable doing that, they're not going to change their whole meeting to do. They sometimes make a few tweaks. And, you know, there's one meeting that we've got an associate that's been sitting on it for years. And, you know, we're only just at the point now where he's starting to feel comfortable to open up. So it is challenging. I think just keep at it, make sure that you've asked all the right questions to the person that's doing the work, and then also just make sure that you're debriefing afterwards, because if they have had a negative experience, they might need support to figure that out afterwards, and just a bit of a boost to say, actually, you did a really good job, and you know, they might not feel that they did, even though you know that they did, kind of thing. I hope that helped.
Thank you, Ginny. And I think that's really powerful. It's something we're finding in platform a lot at the moment. Is there's something about trusting people, I think, in that, and trusting people at all levels and every level to kind of tell you what they're good at, tell you what they enjoy, and tell you what they want to help with. And a lot of the time, it's a bit of a hobby horse of mine, really, about how we need to really restructure and rethink about how we deliver services. And if we do take a place-based approach, then we need to take an approach that isn't about the system coming in and recreating the system just locally. It's about saying, well, actually, what do you want to create locally to help your local area? And it's just a really interesting, and I think it's a constant tension, I think certainly that we experience within ourselves as well, because we try and be honest at Platform about our own struggles, that it's so much easier, and I've done it before, again holding my hands up, I've kind of designed things, so I'm like, right, we'll go here and we'll do that, and I think they're really, they obviously don't really have a functioning bus service, so let's lobby for a bus service, and right, okay, they've got loads of potholes, let's fix potholes, and oh, they don't have a local green space. Maybe that's the issue. And actually, when you go in and talk to people, they want different things. They might eventually want that, or maybe they want that as well. But for a lot of this, it's about saying, well, what do you want? What can you give? What can we give? What can we deliver together? It might be that they don't even need anything delivered, that they just want people to listen to and someone to give them a sense of power and control over their lives. So yeah, I really love all of that in terms of what you've just said as well.
And it really puts that emphasis, Ollie, on that learning structure, because none of us should be thinking that we've created the perfect environment for someone with lived experience to come and engage in, because it will constantly change, and we have to learn from the mistakes, and we have to learn from the positive experiences that we have to be able to make those tweaks. We need to stop and reflect on it, because it will change and it will be dependent on the person. And I think it's just to emphasize that kind of making sure we stop and we learn and reflect.
Yeah, and there's a real, certainly again, what I've learned again with huge difficulty, is how hard it is to step away from expertise. That our system, because it's become so complex and so distant from people, almost by design, but not always deliberately. I think we take pride, and we take kind of some kind of security and expertise, and this is how, so we get people, like local area coordinators, which are brilliant, but we make their system so complex it can't be understood, so then we have to employ people who can help you navigate the system, rather than going humbly to people and saying, well, what is it you actually want? So but that is not easy. And I still struggle with it. So I suppose in terms of the system change side of what the New System Alliance is trying to do, it is about, I think, one of the key messages I would take from today, as well as kind of you need a good structure around it, and the things you're talking about, Ginny, and a commitment to learning and a clear plan, is that acknowledgement of humility, and that we're not necessarily the experts that we think we are. That doesn't mean our knowledge is not important, but yeah, one of the things I thought was interesting on just spending a bit of time on, and I know some people need to go, and that's fine. I'll just kind of keep talking. Well, anyone who knows me, I can probably have a conversation with an empty room, so I'll just keep going until people throw digital bricks at me. So, but I was just really interested. So, Radine has shared about what would be interested to know if anybody has any ideas about how this model could work for a prison population. So, I'm just going to do an awfully cheesy coaching thing here, Radine. I'm wondering if you have any thoughts about how it might work based on what you've heard so far. And I thought it might be really interesting, because one of the questions Ginny asked us was, how do you think test to change could work in your area? So I'm just wondering if we use a few minutes to kind of, talk this through, Radine. Radine, if you're online still, then it would be great to hear your thoughts so far, and maybe we can talk about it as a group. If you want to, if you can always bow out as well, that's fine.
Yeah, can you hear me now?
We can, yeah.
Yeah, okay. Well, I've been listening to what's been said, and I'm been thinking a little bit about how we could use the model here. We struggle very much with agencies for our population here, and I mean, homelessness is very vast. The population is quite a lot of our population is homelessness, drugs, relationships, all of what you've talked about. But the agencies are all separate, so trying to link all those different areas together is very difficult. We do have teams of people in here that do support them to link with these agencies, but they are they're still all separate. And as far as the peer, you were talking about lived experiences. I've actually got an experience of a guy that I worked with who was actually he was into gambling, and now he's on the outside. He's got a very good job working with people with gambling. So we do have a lot of our prisoners who would love to be peer. They would love to share their experiences, but I was listening how difficult that could be. How do we prepare those guys? The negativity, they're always coming to us with complaints about how they've been treated, and how difficult it is to get the services they need. They feel that let down when they get out. A lot of our population are a revolving door. So they get out, they're homeless, they turn to drug and alcohol, back through. We have some guys who even associate this environment as being their home. So can I have my room back? And can I have my job back? Welcome back, I'm back. So that's quite sad, really, that, this clientele are feeling that is their only option, really, to be housed and to be looked after. So I was wondering, has anybody had an experience of somebody, within the prison system or anything, how you think that it might work within a prison, how we could adapt that?
Real, thank you, Radine. Yeah, I'll kind of talk. I don't know if you've got thoughts, Jenny, but I was going to give you some time to think and anyone else to come in, but I could always talk anyway. For me, the reason why I thought it'd be really helpful and interesting to chat about this as a group is for me, the prison system is certainly in the Welsh context is non-devolved, although elements of it are devolved. I know in Scotland, I think it's completely devolved, I believe, in terms of criminal justice. But the other thing but you could apply this to things like welfare as well. There are certain sectors where the public policy direction and the discourse around it, and therefore a lot of the practice within it, can be very coercive and can be very reductive, and even though then we try and potter within the system to be a bit more rehabilitative, or we talk about rehabilitation, or we talk about, pathways into and out of homelessness and prison, instinctively our systems, the way the systems are built, are still very punitive. That's the word I was looking for, punitive. And I'm just, so for me, that's, if we can start talking as people who are outside or connected to or part of that system, it would be really interesting, I think, to see if we could build something quite exciting and quite different, because I think a lot of these ideas that we talk about are very welcomed by a lot of the prison service, for example, but it's really hard within the system and the setting they hold to actually do something completely different. And I wonder then whether, well, I'll stop trying to answer and hold space, but that was some of my thoughts. Is it's about different systems talking to each other, isn't it? And what can we do that's different within the power we've got? I don't know, Ginny, from your experience, you're quite lucky in Scotland to have slightly different approaches, I think.
Well, that's exactly the right answer. How it happens is a harder thing to answer. Yes, we've got better policy in Scotland. Yes, we've been having these conversations maybe for quite a long time now. So we're naturally all getting to the same place at the same point. We're connected with Scottish Prison Services, with No Wrong Door, the lady that kind of sits at the head of the service provision there is one of the kind of decision-making leads that we've got on our panel, and will hopefully be coming to the event. And the people who are inmates are those people that we do consider that are on those hard edges of society and of tapping into all those services. These are the prime people that this project is trying to help, and trying to get out of that cycle of as you said, going into prison, drug use, homelessness. So it's all about them, and without considering the prison service at the same time, we're not going to fix this problem. So, but how you as an organization kind of start the conversations, it's a really tricky thing to do. But it sounds like you've got all the right intentions, and I think it's about continuing conversations, finding organizations maybe in the different sectors, but that are dealing with the same people that you're seeing, getting them together to create kind of like learning cycles so that you can have these conversations. Obviously working with the people with lived experience to identify the challenges. Yeah. And then as soon as you're starting to get that evidence, then you've got a starting point to start to have conversations to policymakers and commissioners and things. We luckily have quite a lot of that kind of research, and we've worked on quite a lot of those projects within communities already. So we've kind of got that information at that starting point. We can stand up and really confidently say, this is the best thing for people. Yeah, I guess it's about tapping into that.
Yeah, thank you. Does anyone have any other thoughts on that?
If I may, hi, it's great to be here. I was just reflecting on what you're saying, and I think one of the key challenges is for partners to really understand the role that they have and the role that they play outside of their pure operational boundary. So it's like bleeding the edges of their ability to work more collaboratively. And some of the work that we've done around the Hampshire and Isle of Wight space has been led by health. But actually the focus was about reducing reoffending, and reducing reoffending has nothing to do on the surface with health, but actually once you start to dig in, it has everything to do with health, in terms of health inequalities, health outcomes, people being supported on release from prison back into community health services. There's so much, as well as homelessness prevention, and so I think it's a real and genuine challenge. I think that sentenced, I'm going to be quite bold here, sentenced prison leavers seem to have more support than people held on remand, and I think the remand community is where the tap is not anywhere near turning in terms of the level of support that we need to be providing for people, the way that we come alongside people, the way that we protect and safeguard their health and well-being through that whole journey. So yeah, I don't know, I don't think there are any easy quick fixes, but it's about for the conversations that we've been having is using a different a lens that speaks to someone, so that an organisation, so that they can see their role in it. And that's been quite key in some of the work that we've been doing with Winchester Prison. But I don't think any of it's straightforward.
I find that really helpful, and for me a perfect example of when you listen to someone who's got knowledge and experience in an area, you sort of go, oh, that's really interesting. So one of the things, again, we've done a lot over the kind of past 4 years at the New System Alliance is just have these ongoing conversations. That's why they're called Conversations That Challenge, because they challenge some of our assumptions. The thing you've just said about, some of the focus needing to be on remand has just absolutely sparked something in my mind there, Sharon, really, really helpful. And I think that in action is, if you create local learning circles, sorry, I'll stop talking, Ginny. I think I'm taking your space, but for me, anyway, if that's all right, sorry, I get excited and I just can't stop talking. I think that's the power of local learning circles, isn't it? Is that if you've got people in the local area or in a place-based area, if Sharon was in an area with someone else in that room say, that's where the real issue is, and suddenly the conversation moves on, and then you can maybe shift the way you're working. And I think our system has become so obsessed with scaling up, with rolling out and quick fixes, and I think that makes it really hard then to really dig deep into the detail. But I'll stop talking now. Sorry, Julie, over to you.
No, I mean, I don't necessarily have anything else to add apart from, you know, if you've got that passion there, it's really likely that there are other people in your community that have a similar passion and are equally as frustrated that nothing's happening and they don't have anybody to talk to. So I would really kind of encourage you to try having conversations with people, and build a bit of kind of support around you, because it's very difficult doing it alone. You're not to be negative, but you're not going to do it alone. You need to build up that support network. So definitely do it with colleagues, but also with the people that you're supporting, but also with people in different sectors who, as I said, who are also supporting those people that you support. And there will be people that want conversation. There'll be people that aren't interested, of course. But you know, if anything that the New System Alliance has taught me is there are a lot of people out there that get this and are equally as frustrated by it. And you know, none of this stuff is new. There'll be people that have worked in the sector for years and have been having this conversation for years, and it's people like me that probably piss them off by coming in and being like, I've got a new idea. But you know, but we've got to keep on having these new ideas because it hasn't been fixed yet. So so yeah, I just hope that that's given you a bit of confidence to just keep pushing, and you're obviously doing a great job. So
I think and Radi's just shared something similar in the chat about sometimes just being listened to is enough for someone. That's absolutely true. And also I think when we think about how complex the systems around us are, if you think about the solutions that are adopted, they're often, you know, quite complex or complicated solutions in and of themselves. And obviously sometimes that's definitely needed. But actually, but also what's really hard, sorry, is what I'm trying to say is when we say in gatherings like this, that actually it's about talking to people, it's about listening to people, it's about understanding each other, it's about hearing each other's perspectives, it's about taking time, it's about being patient, it's about learning. You know, all of that seems like it's too obvious because they seem so simplistic, but actually they're the hardest things to do. Because if you talk to this is maybe a too reductive an approach, but I often think what would get the most pushback from a really traditional rules-based commissioner or government official? So what would they put the biggest barriers up to, or what would they describe? And that's a very, you know, confrontational perspective. And it's more of a thought exercise rather than reality. And actually a lot of the time, or let's put it even simpler, what do we not have time to do in our jobs? And what we don't have time to do in our jobs is think, talk, listen, learn. So actually, if those are the things we have the least amount of time to do, then maybe we need to find a way of doing more of that. And I think take our time, because we are also obsessed, I think, in trying to get things done quickly and cleanly and neatly, and it just doesn't happen like that. I was just reading something that Jane's written about yeah, exactly. And you know, and sometimes it's those kind of really creative, different perspectives, I think, that can make a massive difference. So I feel, I know people probably need to go, so I'm going to start winding down. Ginny, I don't know if you've got any final thoughts that you want to share with us before I conclude.
It's been lovely sharing. Thank you so much for listening to my little bit of the kind of I've lost my words, so obviously it's time to finish. But I was going to say my rant, but I know it wasn't a rant, so that was the only word that came into my head. So I'll stop talking. I've really enjoyed being here and introducing our work to you, and getting your insights. And if you'll have me back, maybe I can give you an update in a couple of months' time or something. Hopefully there'll be a bit more movement, and maybe we'll have an idea of what that toolkit looks like and the types of questions that we're starting to ask people to gather this information. So thanks so much, and thanks for all your questions. I'm going to ask Ollie to send me the chat so that I've got a note of those, so that I can actually reflect and make changes based on those. So thanks so much.
Thank you. And I would just like to say, absolutely thank you to Ginny and to Homeless Network Scotland. The thought that's gone into kind of the no wrong doors approach and the different learning cycles is really interesting. I'm learning a lot just from a distance watching it. So I think it's really exciting. I can't wait to see where it goes. We are approaching the end of the New System Alliance, which is finishing towards the end of September. So one of the things at some point fairly soon, we will be sending around evaluations for people. I know I've seen quite a few of you before, starting to feel like friends from the distance. So I really appreciate people who continue to engage. So we will probably be sending out, I just need to work out how we're going to do it, sort of a survey to the people we've engaged with over the last 4 years, just to see how it's influenced, if it has influenced some of the work you're doing. But one of the most important things I think we've discovered from doing this is that the connections we've made and the relationships we've built have probably been almost more important than the project itself, which I will take some time to formulate proper thoughts about that, because it's never that simple. So I would just encourage you. I saw Radine and Sharon chatting, keep reaching out. I know I've heard from a few people that the connections they've made through these conversations have sparked real work on the ground as well. So please do that, and please stay in touch. And it's been lovely having another conversation with you all, and hopefully we will see you at the next one. So thank you.
Thanks, Ollie. Bye, everyone.
Bye, everyone. Bye.